I want to dive right in here. I love the fact that you guys are finding all the different ways to write to us. First question came in on Facebook on the card site,
Yes.
and we appreciate that. You can write questions in other places. So somebody wants to know, hi, can I ask your advice on how can I get my autistic child to try new foods? She likes processed food, which isn't really good for her, so I want to opt for a better option. Any ideas?
Right. So I'm going to give you a very brief summary of how we do feeding programs, and it's one of those things that I hope is on our IBT site. There should be a module on feeding because it's a procedure and it's a pretty straightforward and easy procedure. You just have to get certain elements right. So let's assume that one of your child's favorite foods is French fries. And instead one of the things you want your child to eat is, let's say, carrots. So you have your preferred foods and your non-preferred, but the non-preferred are the ones that you really want your child to start increasing.
So that's the carrots in this scenario.
Right, exactly. So, in this case, I think your child is on processed foods so I would suggest that you first select a series of healthy foods that you want to teach your child to eat. And what you do is you essentially use the processed foods as reinforcers. So you will have a large amount of the reinforcer first and a very, very small amount of the healthy food because that's where you're at now. So right now your child's eating only French fries. So you'll have a whole plate of French fries and you'll have perhaps one bite of a carrot. Now, keep in mind that in a lot of cases, feeding involves other things. It's not just preference. For instance, children will have a very hard time with the texture of the food, like they can't eat crunchy foods, they can't chew. There's a lot of other factors, and if those are involved, then it's a slower process. And instead of starting with carrots, you'd be starting with mushed, tiny amount of carrots. So it really has to do with what the feeding issue is. There could be swallowing issues as well. But let's assume none of that exists. What you do is you give the child one bite of a carrot and then they can have a plate of French fries. And then tomorrow you reduce the French fries by one and you just, increase the carrot by a very, very small amount. So over the course of, let's say, 2 weeks, you are now giving the child, a whole carrot cut up. And their reward is just one French fry or something. And then you will be able to actually eliminate the reward and add, let's say, peas. And now the child will have a whole carrot and one or two peas and receive a French fry, that sort of thing. Mm-hmm. So you will now, so what you do, like anything else in ABA, you start with a large amount of reinforcer and a small demand. And then you gradually increase the demand and reduce the reinforcer to the point of normal life. So in normal life, we get to have our food reinforcers as long as we have some of our not so reinforcing foods, right? So generally speaking, you'll have, let's say, a protein and a vegetable and a carb, and the carb is usually the one that everybody loves.
Right.
But and with children, it's not uncommon that they'll do the ones they don't like first, so that they can have their favorite afterwards.
Right.
Or with our kids, we always say you have to eat your food before you get your dessert.
Right.
That's because certain foods are reinforcing. So you always want to make sure there's a fair balance, but you want to increase those things that the child doesn't want to eat and just reduce the ones they like to eat that aren't good for them.
Yeah. I'm always struck by, because I'm always thinking, how would I mess this up? Quite frankly, that's the page I'm coming from. How would I mess this up? And I know what I do is that I move too fast.
Either you move too fast or you're impatient. Or
that too.
Or you just don't have time.
Yeah.
Or you convince yourself it doesn't matter. I mean, there's so many reasons that we don't do this with our kids, but it is a very easy procedure. A lot of times I say the reason ABA works is not because parents can't do it. Parents can absolutely learn to do all of ABA. It's mainly because we don't do it. We don't have time. We don't have the ability to be that sort of step-by-step and logical, and we get emotional about it and all these other things. One of the things that happens in feeding programs is that parents get very worried that their child won't eat because
Right.
the child will generally just reject. But if you are sure that there's a certain amount of the French fries and they are dependent on having a bite, just a very small demand, you'll always be successful. If you do it slowly
Yeah.
and do it methodically, you will be successful.
Yeah, I think the lie we tell ourselves is this is going to take too much time.
Right.
And it takes a little bit of time, day after day after day after
Right.
day, which adds up to your whole life is better. And if you were
Absolutely.
to take all the little slivers of time it took, it takes much less time to do the intervention
Right.
than it does to deal with what we're already dealing with. It's just one of those crazy mind things that we tell ourselves, the lie.
And
"Oh,
plus,
I don't
we're
have time for
tired.
this."
I mean, and parents are tired, you know. I mean,
and overwhelmed.
Absolutely. I
Yeah.
mean, I remember even to this day now, my youngest is 14. But, as I'm going home, I'm like, oh, God, it's like 6 o'clock and now I have to do 2 hours of French. And I'm like so tired.
Yes.
But that's it, we're just tired and we try to avoid it. But
Yeah.
truthfully, if you do it regularly, it's less and it makes the rest of life easier.
I just 2 nights ago said, "Boy, I'm just loving going through 7th grade again." that was my little comment.
You have to
Boy,
go-
it's even better than going through 5th grade math
trust me,
again.
Shannon.
Oh.
I'm going through it 3 times. You realize, it's so exhausting. It is.
Oh, yeah, yeah. Anyway, we're going to move on to the next question, which came to us via email. So we love it. You guys always have the option of emailing me directly, or some of you are emailing our autism-live at Gmail, and that's where this one came in. My son is 3 years old and received a diagnosis of ASD and SPD at 2 years, 9 months of age. We are starting ABA therapy with a wonderful provider. We have been encouraged to stop other therapies for now so that there will be no confusion in techniques used with him. It makes complete sense to me, but our OT and ST feel strongly that he needs all of this. We can always add services back, but I know firsthand that OT and ST teach signs that ABA will not, etc. I want to get an opinion from a trusted source and found your website. If you would provide any information, I would be so grateful. And they left their personal information, which obviously we don't share with you at home. But thank you for doing that.
That's wonderful. So that's a pretty easy a question to answer, and it is a common question for parents. So yes, I would also recommend that at this point you stop the other interventions unless there can be full agreement on how the interventions proceed. And you gave a very good example. A speech therapist may go the path of teaching sign language. And in ABA, generally, we don't do that. Generally, we will go the path of teaching picture exchange communication system or some iconic system, which isn't sign. And there's a lot of reasons for that. There's, sign is a recall process. You have to recall certain signs, and then even if you learn all of those, you're limited to other people who can read sign. With a picture exchange communication system, you will go to from there to an aug device to actually vocal speech, and it is recognizable by everyone, and it is a recognition system where the child can just recognize elements that are present. So it's easier to teach a PECS type system or a visual system. So having said that, people have different preferences, but if you were to try to teach a child sign and PECS at the same time, it would confuse them completely and they wouldn't learn either one. So you gave a very good example there. There's many other examples. For example, I might in an ABA program require a certain length of sentence once I've taught the child words and actions. I would want, let's say 3-word phrases minimum or 5-word phrases minimum because I'm expanding their language. And the speech pathologist may accept less. And that'll cause confusion. That'll cause a lot of delay. So, and occupational therapy really, in my mind, is not necessary for every child. It really just has to do with the child's needs. I also don't think speech is necessary for every child. I think you need to really establish what your child's needs are. If there's a very significant need for sensory integration / occupational therapy, it won't conflict necessarily. I have a lot of our kids doing OT, and it doesn't really conflict with what we do. I don't usually like to start programs with a speech and language pathologist and ABA at the same time. I do like to do ABA first. you should see, if you have a good provider, pretty rapid advancements and progress with your child in the first 6 months to a year. I'm not sure if you'll ever need to go back to speech. You might if the child doesn't develop vocal expression. Speech pathologists are much better than ABA people at producing sound. They have a lot of techniques that ABA people are not trained in, such as prompt technique, which helps the child initiate sound. So if that becomes an issue, you will need to go back to speech. Later on, with sort of some areas of pragmatic speech, you might need some help with speech. There's other aspects of things. If your child has apraxia, you will definitely benefit from speech before doing ABA. But if your child, if I were you, I would just start with an intensive ABA program and see how the first 6 months go and whether or not you need the other services. And having said that, I think that's all I wanted to say.
Can I throw a couple of 2 cents in, though?
Please.
A lot, just to give you another perspective, though, a lot of parents were saying for a long time, don't say no to the OT and the speech no matter what, because if you say no to it, then you've refused the services and it'll be really hard to get them back. Mm-hmm. But I want to add to that, because we've learned more since those days, that there is a way that you can say we don't have time in our schedule right now, and not sign off on your IEP saying that you've refused those services.
Right.
You can be very smart about it, because usually it's your school district that's offering the OT
right.
and the SP. Sometimes it's insurance.
Right. Well, now when about 5 or 6 years ago, it was always the school district. Yeah. But now it's almost always the insurance.
Okay.
So things are changing in that parents are accessing these services through different funding sources, and that's the key. You're right. If it's an IEP, if there's an IEP involved in these services, you have to be very cautious and say why you want to delay the start of these services.
But you don't want to sign off. A lot of times parents were,
That's
this
right.
is the old thing, was the parents were given something and they signed off and they could never get it back.
Right.
If you're just smart about that, that doesn't have to be a thing.
Right.
But I think what's key as a parent that makes my heart beat a little bit faster is prioritizing. Mm-hmm. Because everybody who's advising you, they're going to be prioritizing their thing.
That's
and
true.
saying, well, you got to have the OT because it's important for this, that, and the other thing. And the speech and language pathologists are going to say, you got to have this because whatever. I just think it's important, especially early on, that you prioritize the ABA, and everything else is secondary.
Correct.
Everything.
Absolutely. And that's a little, I don't want to be arrogant about it, but truthfully, you should be following to the T an intensive early intervention program. Your child is very young. Congratulations for getting in that early. And I wouldn't worry about those other things right now. Think about this. You're talking about a program that has an intensity of about 40 hours a week versus other services that are about 1 to 3 hours a week. Yeah. So you can't go wrong here.
Right.
But the only area where you can go wrong is if you do less than 40 hours of ABA. If someone is telling you to do 20 or 25 hours right now, that's a mistake. Your child is 3. That is the age where you need an intensive program, and school isn't included in that, and other therapies are not included in that. We're talking pure ABA 40 hours. And that's your best chance.
Okay. Now, we had a question that came in this morning. It says, question for Dr. Granpeesheh. Can you please ask her to talk about ASD diagnosis for adult women? I have a 7-year-old with autism that has been receiving wonderful intervention from CARD for a few years now. I've been obsessing over his treatment and therapy since he was diagnosed. Spreadsheets, research, conferences, etc. I recently came across a chart for Asperger's in women, and I was just blown away that I could relate to most of it. Social anxiety, poor eye contact, sensory issues, missing social cues, mutism when upset, and have learned how to put on an act when I need to blend in. How can I pursue a potential diagnosis, and what help is available for adults? I'm almost 30 and live in Los Angeles. First, sending you a hug. Right?
Absolutely, yeah. Many hugs. And kudos to you for recognizing certain things in yourself. I can tell you that and I always go back to this, and it's sort of important to pay attention to this because we all see various things in ourselves, and if we were to take them to an extreme level, we would all be diagnosable in one way or another. The key to a diagnosis is that it causes the individual to be disabled in functioning in their family or at work, like in their society, basically. So, I've always used this example that someone could drink 10 bottles of scotch every night, but as long as they go to work, have friends, have a healthy relationship with their family, then it's not diagnosable. It's not considered a disability or disorder. A disorder, by definition, means something that prevents you from functioning well in your society. Now, so let's start with that. So you have already gotten to a point where you are functioning. You have a child, your child's in a program, you're doing very well, which, by the way, I'm glad your child is with us. But you're just seeing certain things that you would like to improve upon because you feel that you have social anxiety, which is never comfortable. And you feel like there are certain social situations where you don't feel comfortable, you feel fake, or like you're faking it. And that's perfectly fine, and you can work on those things. I'm not sure a diagnosis would benefit you in any way. There's just certain things you want to work on, and that's perfectly fine. Now, the best way that I would suggest you work on these things is that you can use your child's skills account to actually ask your supervisor at CARD to give you access to your child's skills account, and then go into the sections that have to do with executive functioning and cognition. Those two domains, those two areas will have a lot of ideas for you in terms of how you just read through them and see, the advanced ones, and read through them and see if you have difficulty with any of those. And if you do have difficulty with any of those, then I would suggest that you actually practice those types of activities yourself. There are many, many books, a lot of really good books written by Tony Attwood on the subject of Asperger's and how you can use various things in your environment as tools to help you cope with the environment. Because you mentioned social anxiety, I think it would benefit you if you talked with a psychiatrist and considered an anti-anxiety medication. I think something like 80% of Americans are on anti-anxiety, which is the same as antidepressants, by the way. And you might find that to be very, very useful to you. There are many causes for anxiety in our lives, obviously, and just taking the edge off a little bit would perhaps help you get through life much easier. And if you didn't have the social anxiety, a lot of these other things that you're experiencing might go away. So it is more about dealing with the anxiety. I often talk about how anxiety is part of autism. Like, I see so much anxiety with our higher functioning kids. And I think it's a big factor. So, whether or not it's there because you also have Asperger's or it's just anxiety leading to a lot of these feelings, you need to deal with the anxiety. And there's a multitude of ways to deal with anxiety. There's a whole section on anxiety in our, where is it? It would probably be in our maybe social curriculum. I'm not sure. So you should really look at those areas and see if those help. But get in touch with us again if I haven't given you enough resources.
And I think, there's an expression in the autism community that we say puppies don't have kittens. And it's a way a lot of autism parents relate greatly to certain aspects of where their children are on the spectrum. And I always say we're much closer to our children than maybe all of us are willing to admit or accept. And, my husband and I have conversations where we will say to each other, oh, well, that's where you're on that spectrum. Right. And then he'll say to me, and that's where you are, right? And we mean that lovingly. But it's just very interesting to notice because it is a big spectrum of different considerations, and everybody has something, right? It just doesn't add up to you being not able to function, right, and having that disability. But I applaud you for looking at this and recognizing that there are things to work on. And I can tell you, when I first sat and read through skills, I was like, oh my gosh, this is so
There's
good
so
for
much
me.
stuff
There's
there,
so
yeah.
much that I learned, and I'm still working on, having done skills. And as somebody who used to teach 7th grade, I said every single junior high school student should have to go through the executive functions curriculum. Every single, I'm not talking about kids on the spectrum, every single human being would be more productive if they had that as part of 7th grade curriculum standards.
Honestly, I know, I agree. It's just there are so many really good techniques. It's just techniques for learning and for self-improvement and self-awareness. And I mean, this is someone who's already very aware.
Yes.
And you'll get a lot of tools there.
Absolutely. So yes, write to us if you want more information, but what an inspiring question.
And excuse me, one
Yes.
other thing is, Shannon, I think in the past we've posted numerous shows we've done on anxiety, and I
Yes.
think you would maybe enjoy looking at those as well.
Yeah, absolutely. Good question. I want to take something from Twitter now.
Sure.
Somebody wrote in and said, how do I stop my 12-year-old son with ASD from throwing and breaking things, not in anger, just to watch it fly?
Right. So, and that's a very, that is a common thing, and I really commend you as a parent for having noticed that your child enjoys the observation of things flying, which is kind of interesting. Often we think, it takes parents a long time to figure out that they just really like how it looks. So, it's a hard thing to control, but the way to control it is that you need to replace or have certain periods of time where he's allowed to engage in that activity or some form of that activity, and that would then kind of be his release period, and the rest of the time he's not allowed to. So the way that a behavior analyst would do this is they would essentially take a measure of how often does he do it during the course of the day, because the idea would be to reduce it, to limit it to certain times. So let's say he does it all day long, and then what we would do is limit it to from this time to this time only, or from, that's kind of the concept. And during that time, initially you would allow him to throw objects in a safe environment, safe objects. So not like, you would make sure that he's in an environment where perhaps he could throw things like pillows, stuffed animals, tissue boxes, things that are not likely to break anything. And also you'd want him in a room where there's no glass, those types of things. And that will, so that when during the times when he's not allowed to, if he needs to do it, initially he would ask for a break. He would ask to go to his throw room or whatever you want to call it. And then over time what you do is you allow him to go to his throw room, not every time he asks, but on a particular schedule. Initially, he'll be asking and going, but then later what you'll do is you'll say, okay, we're going to go in 10 minutes, and you'll set a timer, and then he'll go in 10 minutes. And then what you do is you have a break every hour, let's say, or every 2 hours where he's allowed to go for 5 minutes. And then eventually what you'll end up doing is saying, okay, you can only do it from like 6 to 7 p.m. at night and 8 to 9 a.m. in the morning, or whatever it is that you decide. And at the same time, so this is how you kind of get rid of it in his daily life. It's a process, and that's why it's better to have a behavior analyst help you with this shaping process. But the other aspect of this that will happen over time is you'll try to find normal life things that he can use to throw. For instance, put him in basketball. Teach him how to throw a ball into a hoop, because that's something he will enjoy doing and it's very functional and normal. Find things where it is appropriate for him to engage in this activity and it's not a big deal. Like even if he's like in swimming, he could certainly like throw a ball around in a pool, or if he's on the playground, you can use this as throwing a ball to other kids and so on. So, you can use some real life situations. Even video games these days, there's a lot of video games that will allow you to see that kind of projectile of throwing an item. In fact, what is it? Angry Birds, for instance, is a game that has to do with throwing. So find things that are sort of more normal, adaptive, and he would be allowed to do those, and then restrict him in other environments.
Wonderful. And you have used this technique on many children. There is an amazing drummer who had a stim,
right?
And you morphed that into, he's a world-class drummer, was playing at the Hard Rock Cafe this last Sunday.
Crazy.
Just saying.
Yeah.
Okay, we're inundated with questions, so I'm just going to forge on, and you tell me when you're faint.
Sure, no, go right ahead. I feel better.
Okay, so I'm going to take something from Facebook first. We had somebody write in and say, what's the best way to talk to my daughter about her menses? We don't have an age.
Right. I mean, this is a very hard question for me to answer because I don't know the functioning level of the child or the age, assuming the age is somewhere between, let's say, 12 and 14.
Right.
Or maybe younger, and you want to tell the child what's about to come. I would have to assume that the child has some level of comprehension, but it's still very difficult for me to answer this because depending on the level of understanding, there are a variety of different things. I mean, if you have limited understanding, then there is no need to explain what menses is like any other child, where you basically would just explain, this is going to happen, this is okay, and this is how you deal with it. So there's three aspects to it, which is what is actually going to happen. The fact that you're not bleeding and dying, it's a normal cleansing process. And the third is how you have to take care of yourself during that period of time. Those would be the three elements that are very important to explain, and not necessarily, what is actually happening in your ovarian tubes and so on and so forth. You don't
Nobody
have to
ever
get into
explained that to me. I mean, I had to get that much later, So.
That's how I explained it to my kids. This is the egg.
Right.
But you don't have to go into that, obviously, and you just have to kind of say, oh, this is great. In fact, in our culture in Iran, it's a celebratory thing, because you have now become a woman type thing. So it is something, and I think it's good because it's a fear-evoking experience the first time, and I think that it makes it much less fear-evoking and much more like a positive experience, which I think is important.
I grew up in an era when half of my friends called it the curse and the other half called it their friend. That's so confusing. Which is it, the curse or your friend? The curse is visiting. My friend is visiting. You never, it's all perspective, right?
Yeah, absolutely.
Anyway, I interrupted you. Sorry.
No, I was just saying that I think it's very important for girls to not feel afraid. And the other aspect is with some of our children, I mean, I remember very, very early on in the old days when I was training a school district in Chicago, I think, or somewhere around there. And they had a classroom, and this is so long ago, we're talking like early 80s maybe. And they had a classroom of teenage girls, and they were all starting their menses, and it was and these were all pretty severely disabled children with autism. And I was trying to teach the school how to prevent, the children doing inappropriate, like getting blood and rubbing it on the walls, sort of a different version of feces smearing type thing. And that's something you got to be cautious about, depending on the functioning level of the child, is that it is an interesting, curious experience. And you want to make sure that the child doesn't get too much into sensory stimulation of this. So something you want to be aware of.
Yeah, very concerning. Okay. Yeah. And our other question that came in on Facebook from Puerto Rican Mommy wants to know, will it ever get easier?
Oh, it does get easier. It gets a lot easier. And I'm so sorry that you're going through a tough time. I guess the only way to think about it is we never really get anything we can't handle. Most of the time, the universe, God, knows how much we can take, and we have to go through these stages as we become more enlightened and wiser in life, obviously, and some can take more than others, which is why you have that blessing, I want to say, of difficulty or of a hard time. Because you are strong and because you can take it. One of the things I tell my staff, Shannon, every training I just did yesterday for supervisors here is, they're all very young folks coming in with master's degrees and BCBAs, and many of them don't have children yet, and I take them through what it might feel like to have a child and then the child to be diagnosed. And I tell them that they have to be respectful and honor the parents, because they could never, so few people have the ability and the strength to go through what autism actually is. And to be an autism parent is a distinction that no one else can actually understand. And the truth is, it's an incredible, difficult time, but you have to just know that you're strong enough to handle it. Know that you can do it. There is no failure. You just do the best that you can, and you get as much help as you can. And don't give up. Sometimes, especially when you're out international countries, I hear stories where moms are just left on their own, and dealing with everything. Just try to reach out, pray, that the help will come. And if there's anything we can do for you, just let us know.
Right. We get through this together.
Yeah.
I know you feel sometimes alone. I certainly felt that in the early days, but
it does get easier,
it's an amazing
though.
journey.
It is an amazing journey, and it's kind of like God's way of making parents really, really appreciate every single step of the journey. It's like, how many times around this time of the year actually is when I start getting a lot of emails and letters from parents just saying, this was the first time he enjoyed Christmas with us, or this was the first time he said I love you, or what, and it's a pretty significant step, and it's the first time your child says words, the first time they look at you, the first time they hug you, the first time. We don't remember that as parents of typical children. We don't remember when that happened. And with parents of children on the spectrum, it's a step-by-step journey where every accomplishment is enjoyed and highlighted. So yes, it gets easier, and yes, your child will learn. And even if you do nothing at all, there might be tough phases, but children generally start to improve when they go past the teen years, just because their hormones change and various things happen. So don't worry, just do the very best you can. And honestly, if I was a parent and I had almost no resources, the one thing I would do is I would get on the Institute for Behavioral Training site, the IBT site, and I would learn all these techniques myself so that I could be empowered to make some change with my child myself. All you really need, this is why I made all the training modules. This is why I had the dream of having skills. Why those two programs together, you can do anything. A parent can do anything. You can go through all the training. We give our BCBAs, all of it, at very little cost. For I think less than $1,000, you can go through everything on that site. And
it would take you a long time to go through it.
It would take you a very long time because there's hundreds of modules of training. But let me tell you, you will be very well trained. And then after that, you just have to use skills. Skills will guide you through every single thing. You could potentially, the resources are there. The energy, I don't know, but the resources are there for you to do a full program with your child. So, you can just go to those sites, and they're very cheap. They're not that expensive. So oftentimes I feel when we feel afraid, we freeze and we don't do anything. One good way of getting over that is just to do something. And the thing to do for you right now is to learn.
Wonderful. We've got tons of things coming in, so I'm going to continue on with a question. Somebody said thank you.
Sure.
By the way, my teenage son is nonverbal. He used to use his Nova Chat fairly well, but it went missing, so he went back to his PECS board. I can't get him to communicate anything in capital letters with it. School says he uses it sometimes, but I don't get any communication with it, and self-injury and teeth grinding has increased. I know we need to find one form of communication for him. Do we find another device? I was thinking of using an iPad or continue with the PECS. I'm frustrated, and so is my son, and thank you very much.
I would really seriously suggest that you use an aug device. If he was already at an augmentative device, like NovaCheck, then I would try to go back to that. PECS is usually it's a limited form of an aug device, and we use PECS in the process of going to the use of an aug device. So we will use PECS as our primary visual initial introduction to a visual program for the child, but then ultimately our goal is always to go to either an iPad or an augmentative device. Now, there's differences. Children do different things with different ones. Aug devices have many more capabilities than you can have on, let's say, Proloquo on iPad. but they're more expensive, and your child has to have it with them all the time. The benefit of an iPad is you can go all the way down to an iPhone, or an iPod, and then they're communicative.
Right.
However, the benefit of an AUG device, there's many. They can express themselves in many other ways. It's kind of easier to work with those. Another thing that you should consider is with an iPad, it's easier for you to program or use protocol. With AUG devices, you need someone to help you program it. It's not an easy thing. Those are the pros and cons, but definitely I wouldn't restrict the child to a PECS device. I would definitely move forward. And this is one of the most important things. And if you can't afford the AUG device, ACT Today does fund these, and it is one of the things that you can certainly apply to our funding, Autism Care and Treatment Today, and we would try to be able to help you with that funding. It is also something your school district is responsible for funding, so I would go there as well.
And a lot of insurance is now paying for iPads as well for nonverbal children. The ACT Today grants, the next phase that is open is January 1st, unless you apply for an SOS grant, which you can do at any time. And again, that's act-today.org for anyone who's watching. I just want to say somebody wrote in Facebook and says it was very nice seeing you last month at a new office and that you got to meet their little one. I'll tell you the name when we're not on, and their supervisor. But they would love to get in touch with you via email and want to know how to do that. I want to encourage you, just send the email to me and I will make sure that it gets forwarded to Dr. Granpeesheh, s.penrod@autism-live.com. So written on our live site, do you have any resources for teaching teens on the spectrum how to cross the street? We are using discriminative training, but our student is still struggling to know when to cross.
Yeah, we do. I'm not sure exactly where it is. I know this video, but we have video, and it's either in our adult website, under one of the videos for safety, or it's in skills under the safety protocol, which would be in adaptive skills.
Okay. So check that out. You can do a 14-day free trial of skills to look and see, and then you'll have access to the whole lesson. It is one of those 14-day free trials where you give them your credit card number and you have to cancel it before the 15th day, or you will be charged for the next month. So and then you can check out the Card Adult site, and that there's a tab on. If you go to centerforautism.com and just click on the Card Adults, we're going to be talking about that in the next hour because we have one of the actors who was on the Card Adult video, training videos, that's going to be joining us in just a few minutes. So that will be really fun. Okay, next question. This question is for Dr. Doreen. My 5.5-year-old son with autism has tons of language and can talk in 4, 5, and 6-word sentences, but his social skills are really delayed by 2.5 years. I called a few places for ABA services, but they tell me that they can't provide social skills services if there are no other small kids in the house for my son to practice the skills with. I have 2 other kids, but they say they're too old. They're 14 and 12 years old. I'm really desperate because I don't want my son to be 6 and still not to be able to be social with other kids or have friends. I know he can learn this. He just needs to be tough. Can social skills...
he just needs to be taught.
Taught. Oh, thank you. I wasn't...
Sure.
Can social skills be taught by a therapist with other peers?
Without
other peers. Thank goodness you're here to read with me. Please help me. I'm desperate. We're in New Jersey, and thanks so much for everything you do for our kids.
Yeah.
Great question.
Yeah, very good question. And absolutely, yes, 100%. In fact, having other kids is only the very last portion, which is used to make sure that the skills that they learned are generalized. But there's a ton of stuff you do prior to having other kids, and yes, you can absolutely teach social skills before you go to other children. So here's 2 things I would highly recommend. One is, again, I would have to make sure that you know some techniques. So just basic techniques which you would learn. The section on the IBT website, which is Institute for Behavioral Training, which is called Teaching Skills. And so you would want to go to the Parents section and go to Teaching Skills section, and you'd learn some basic techniques. Then you want to go on Skills, which, as Shannon said, you can even do that in the first 2 weeks for free. And when you go to Skills, you will want to go to the social curriculum. and then you'll have 1,000 ideas. I mean, there's like so many different things, particularly also if you go to the play curriculum, there's a whole section on peer play. So you'll get this. I'm giving you too many resources. Like you'll have easily maybe 40 lessons that will apply to this particular thing, and they're under the two areas of play and social. The other thing I want to suggest is, and I don't know if it's out, I think you can get it online. A lot of our offices are in the process of doing this training now, but UCLA developed a program called Peer Play. It's called Peers, P-E-R-S, and it's a social skills program, which I find to be very good, and so we're starting to use it at CARD. So if you can find that online, or if you can get that as a copy from UCLA, it's been published, so it should be out there, Peers. Then you can learn the techniques there, and you can certainly start practicing those. But again, with social skills, we give our kids the tools first. We teach them how to, let's say, pay attention to other kids, how to take turns, how to interact verbally with other kids, how to share, how to give and take, how to pay attention to when they're losing interest. There's like a million things. And then we practice various games and so on with other children. But the tasks certainly can be taught to the child, and you can practice them with the siblings, because it will help generalize. The more people you practice these things with, once the child has learned, then it will generalize easier to younger kids.
Wonderful. And it just occurred to me when you were talking about peers, because you mentioned that you're in New Jersey, and Kelby, you have to help me because I'm having a senior moment. But one of the favorite new guests that we've had on the show that I just adore, we just interviewed him in Texas. He's the author of the book Overcoming Anxiety in Children and Teens. Jed Baker, Dr. Jed Baker,
yes,
teaches social skills in New Jersey and has like 9 locations. Google Dr. Jed Baker in New Jersey and take a look, because he's
terrific.
Just loving him. So you're there. You're in New Jersey. You're yay.
That'll be a very good resource.
Okay, I want to move on to another question that's written specifically by a friend of the show that we just adore. So I'm not going to say her name, but she knows who she is. The other day, her son. She was talking with her son, and he said, "Shut up."
Yeah.
Naturally, she says, I was upset and told him that was not okay and sent him to his room. When I came into his room and talked to him about it, he said that his brain was cursing and he was telling his brain to shut up. This isn't the first time he says his brain is telling him things or making him do things, bad behaviors. Or he will say things like his brain is controlling him when he's doing bad behaviors. Is this something I should be concerned with? Should I be concerned with schizophrenia, or is it a way of not being blamed for things?
I don't think it's either one, and schizophrenia has a different twist to it. It's a little bit different. Schizophrenia, there's a lot more absence of the person being there. I don't think this is schizophrenia personally, and I can't tell you that for sure because I haven't seen him, but this does not sound to me like schizophrenia, and I did a lot of work with schizophrenia. What I want to say is, I think he's just expressing himself in a different way. Obviously he is to some extent blaming the voices, but if you really think about it, we all experience exactly what he's describing here. We all have voices in our heads. The voice of you telling yourself to wake up or go for a run or eat or not eat, that's all voices in your head. And sometimes our kids get confused and sort of blame those voices, and it's just like me saying, like anyone saying, oh yeah, I had chocolate at midnight because the voice in my head said I have to do it, you know? And it's more like the other voice I didn't listen to said don't do it, you know?
Right.
So it's dialogue in your head, and I wouldn't worry about schizophrenia at this point, but what I would do is we have a program I think it's in our cognition curriculum that's called Think versus Say. And this would help you with this because it teaches our kids to differentiate what they say versus what they think. Because See, our kids a lot of times with theory of mind deficit don't understand that what's in their head is private and they can keep it there. They think it's the same thing. If they hear it in their head or say it, you know it. And so if he understands that things that are in his mind are kept private and they're okay to be there as long as they don't come out of his mouth, then that'll help him control those things.
And I gotta say, I got a grin on my face because I think this is a good sign.
Yeah.
He's starting to think about thinking. He just
Absolutely.
doesn't know yet that's what he's doing.
Absolutely.
And that's
Good point.
that's
Good
a
point.
really step progress.
Absolutely. Good point. Yes.
So be excited
quite
instead
aware.
of afraid.
Right.
That's a really cool thing.